Okay. Hi guys, this is Dr. Neda Nafei from Synergy Integrated Medical Center in Dubai. On our next series, the question I want to answer you is, what is a disc? What is a disc problem? Disc basically is a shock absorber. If you look at the vertebrae, this is a nice normal disc, and the disc is supposed to have a nice height to absorb any type of shock in between the vertebrae. Over the period of years and over trauma or sitting too long or lifting heavy or just poor posture, the disc can start deteriorating and the water in between can evaporate and the spaces become closed and they get close to each other. And it can even get worse if you come here. This is a thinning disc, as you can see, or this is disc degeneration when you actually have osteophytes, little calcifications that are coming out. And these holes that the nerves are supposed to exit from, they become smaller and smaller. They put pressure on the nerve. For example, on the lower back, we have sciatica, which is the thickest nerve in the body, and you can start getting numbness or pain sensation down your leg. Or in your neck, if you started feeling any numbness in your fingers or pain radiating down the arm, is usually a disc problem, which happens in the vertebrae in your neck, number 5 and 6 mostly. Now, we also have another disc disease, which is if the disc, the height is fine, but you get a little bit of the liquid gel from inside to come out, and this is called a bulging disc. That liquid gel can also completely rupture and pinch the nerve, and that's when you get a lot of pain. Let me see if our lovely photographer can zoom on these. So let's get close. Now this is again a good vertebrae, and this is a good disc, and it has a gel. This is a disc that is bad, like the one we showed on the picture, and the bones have gotten very close to each other and has created the osteophytes. The edges are not smooth anymore. They are very rough, and calcifications are coming like a prison bar. They are closing. They're creating like a natural fusion of the spine, and they don't have enough motion in there. This makes the vertebrae very weak, waiting for an accident like a sneeze, a cough, bending over to lift something very not even heavy, and the disc, the little liquid gel, suddenly pops out. Now, most of the questions that patients ask is, can you push this back? No, this doesn't really go back in. If I want to give you an example, imagine if you have a cut in your hand and it's open, blood is gushing, it's red, it's painful, and a piece of meat is actually out. Would this stay like that? No. Body is self-healing. So body eventually is going to heal this and close this wound, but there will always be some sort of a scar tissue in between. And that piece of extra meat is going to fall off because it's not part of the body anymore. What we are trying to do through chiropractic care is by creating enough motion and releasing the pressure that is around this joint, we are trying to help the body to close this wound as soon as possible, just like that hand of yours that the body closed. So the more blood and the more nutrition reaches to this disc, the body can heal itself, and that piece of the disc either gets absorbed into the body or it's not inflamed anymore to keep giving you pain. Chiropractic helps with the disc problems in order to help the body heal itself. Thank you.